You know, oftentimes patients are given the diagnosis of fibromyalgia for lack of another cause for the symptoms that they're experiencing, the widespread pain and the fatigue. And so one of the questions that I get frequently asked, and one of the things that you should be aware of, is how to know whether or not the symptoms associated with what has been diagnosed as fibromyalgia in your condition is in fact fibromyalgia and not the symptom of some other disorder. Chronic widespread pain that lasts for at least 3 months is a classic sign of fibromyalgia. You may wake up with stiff muscles or find that you're fatigued or having trouble remembering things. Well, fibromyalgia can also coexist with other health conditions like arthritis and chronic fatigue syndrome and mood or sleep disorders. Fibromyalgia symptoms may intensify depending on the time of day. Morning, late afternoon, and evening tend to be the worst times, while 11 a.m. to 3 p.m. tends to be the best time. They may also get worse with fatigue, tension, inactivity, changes in the weather, cold and drafty conditions, overexertion, hormonal fluctuations like just before or during menopause or your menstrual cycle, stress, depression, other emotional factors can all play a role. Now, the pain of fibromyalgia has no boundaries. People describe the pain as deep, muscular, aching, throbbing, shooting, stabbing. Intense burning may also be present, and quite often the pain and stiffness are worse in the morning. And you may hurt more in muscle groups that are used repetitively. Slight bumps and touches can cause disabling pain if you have fibromyalgia. This pain can be aggravated by outside factors, noise, weather changes, and stress. To figure out what's going on, doctors diagnose fibromyalgia by examining specific tender points on the body. Now, as you probably already know, there are 18 specific points and specific locations that are tender for everyone. But for people with fibromyalgia, these points are significantly more tender. Tenderness or pain in at least 11 of these 18 points is the hallmark of fibromyalgia. So when the doctor presses on these points, they may or may not hurt. So it's fairly easy to diagnose, except the doctor has to determine if there's any other disease present that is causing your pain. So he or she may do some other tests to rule out things like infection, thyroid problems, rheumatoid arthritis, sleep disorder, cancer, and other conditions. But pain isn't the only sign. Besides sleeping problems, muscle aches or joint aches or general body aching and fatigue, there can be facial muscle pain or aching. A reduction in your desire and ability to exercise is very common. In some pain sufferers, the symptoms may get better, then return out of the blue. Now, other common symptoms can include memory and concentration problems. This symptom is referred to as fibrofog. Fibromyalgia patients have serious difficulty retaining new information if they're distracted. Of course, there are sleep disorders associated with this condition. Patients report trouble falling asleep and, more importantly, staying asleep. But the unrefreshing quality is what makes the disorder much worse than insomnia. Also, there are exercise difficulties. Moderate intensity exercise activates a powerful pain-relieving system in healthy people, but it makes the pain of fibromyalgia worse. This is why initiating an exercise program may make you achy and tired. However, if you do not exercise on a regular basis, the performance of normal daily living activities will start to cause more pain. Rather than give in to the increased pain sensitivity related to exercise, patients are advised to do mild exercise in short intervals, like 5 minutes at a time, to keep the muscles fit while not overtaxing them. Other symptoms include irritable bowel syndrome, constipation, diarrhea, frequent abdominal pain and bloating, abdominal gas, and nausea represent symptoms commonly found in roughly 40 to 70% of fibromyalgia patients. Chronic headaches, recurrent migraine or tension headaches are experienced by 50 to 70% of fibromyalgia patients. Most headaches are rated as severe, occur at least 2 times a week, and have a migraine component. Now, the jaw pain, temporal mandibular joint dysfunction, causes tremendous jaw-related facial pain and head pain and affects 1/4 of fibromyalgia patients. Typically, the problems are related to the muscles and the ligaments surrounding the jaw joint and not necessarily the joint itself. Now, aggravating factors can include changes in weather again, cold or drafty environments, hormonal fluctuations, premenstrual and menopause states, stress, depression, anxiety, and overall exertion can all contribute to fibromyalgia symptom flare-ups. Diagnosis may be challenging, so remember, clinicians have to rely on your symptoms and medical history to make a diagnosis, since there's no lab test or x-ray to confirm the disorder. Most fibromyalgia patients are initially diagnosed on the basis of widespread pain and fatigue longer than 3 months in duration. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my Fibromyalgia Roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.